Good evening and welcome to Doctors on Call. I'm Dr. Mary Owen, Associate Dean of Native American Health and Director of the Center for American Indian and Minority Health at the University of Minnesota Medical School. I'm also a family physician for the Fond du Lac Band of Lake Superior, Chippewa. And I'm your host tonight for our program on influenza, pneumonia, and emphysema. The success of this program is very dependent on you, the viewer, so please call in your questions tonight or send them in ahead of time to our email address. The telephone numbers can be found at the bottom of your screen. Our panelists this evening include Dr. Jane Rudd, a family medicine physician with Essentia Health West Duluth Clinic, Dr. Sandy Stover, a family medicine physician and faculty member at the Medical School Duluth, Dr. Andrew Thompson, an infectious disease specialist with St. Luke's Infectious Disease Associates. Our medical students answering the phones tonight are Kayla Edgings, sorry Kayla, from Alexandria, Minnesota, Mary Jane Evans, Big Lake, Minnesota, and Logan Hooker from Sandstone, Minnesota. And now on to tonight's program on influenza, pneumonia, and emphysema. Thanks for being here this evening.
Good to be here.
And good timing for this show. So we were just talking ahead of time about, until we get some questions from our audience, we'll ask some few questions amongst ourselves or talk a little bit amongst ourselves. Influenza, are we starting to see it? Are we just now seeing it? Has it been going on? Where are we at?
Yeah, I'd say it was a little bit of a late start this year, so we are starting to see it. We're seeing more influenza A, and it's pretty typical year. So influenza most of the time comes in really hard, so you feel pretty good, and then all of a sudden, within an hour or two, you have a bad headache, you hurt all over, and you start to get a cold or a cough. So it's pretty typical influenza year, I would say.
Okay. Anything to add?
I've seen an increase in hospitalizations due to influenza at St. Luke's.
Okay.
And when we look at the numbers nationally, influenza activity usually starts first in the southern U.S. and moves north. And we are starting to see that. We've seen it move northward, and I would expect in the next few weeks we'll be seeing more cases.
Dr. Stover, when we say influenza, are we talking, is that like pneumonia? What's the difference between influenza and pneumonia?
And that's a good question, because the term flu or influenza can be used for many things, but true influenza is a viral infection, a specific virus that infects our lungs and creates an entire body reaction because it has that kind of a stimulation or a shock to the system. So particularly for people who already have something in their lungs or in their otherwise in their health, it can be even more problematic because it tends to sort of be that shock wave across the body.
Can you have pneumonia and influenza then?
You can. The influenza, so pneumonia is a term that's used when the lung tissue itself is infected and there's fluid often as a reaction from the body to the invading organism, and it can be a viral pneumonia, like an influenza pneumonia. It can be a bacterial pneumonia, and some viruses tend to create enough problem in the lung that the bacteria take advantage, and you can have a bacteria on top of a viral pneumonia. And of our immune systems are the warriors that help to keep that at bay. So, keeping your immune system as healthy as possible is a great way to minimize how hard the flu might hit you.
Dr. Rudd, should doctors always be expected, when you go in to see your doctor, should they always be expected to treat you for influenza?
It's a really good question. When you get the flu, you often feel really, really sick. And you'll come to the doctor, and one of the things that surprises me is how sick people feel and how normal their exam can be. So their lungs can sound clear, their ears can look fine, their throats don't look that bad, but the patient feels terrible. So it's not uncommon for us to not treat other than symptomatically. On the other extreme, people that have underlying conditions can get really, really sick and need to go to the hospital. So it isn't uncommon that we see them in the hospital as well. There aren't a lot of treatments for the flu. If you have high-risk condition, asthma, you're a smoker, you have other lung problems, we sometimes will give an antiviral medicine, but it has to be given in the first 2 or 3 days, and often people are so sick that they don't come in until the 4th or 5th day, and then it's kind of too late for those antivirals to work.
Dr. Thompson, if they do make it to the hospital, are they usually treated with an antiviral at that point, or what other things what do they go into the hospital for?
Right, so people sick enough to be hospitalized for influenza might be there just because they need support. They need oxygen, they need other medications. If it's early in their disease course, they would usually be treated with an antiviral medicine. Sometimes they're there because they have complications and they need treatment for that bacterial pneumonia that they got after the flu.
Okay.
So it really depends on their underlying health conditions, how we would treat them in the hospital.
So it sounds like one of the things we're watching for when they get that influenza is the secondary complications like pneumonia.
Yeah,
Or
it's
they
certainly
have to-
possible.
Now we hear about pandemics. We know we just all experienced one. How about influenza? Can it cause a pandemic?
There have been a number of pandemics across humanity, as long as influenza has been around, and there's a sequence of influenza, amongst many other organisms, can sort of change its coat, so that even though people may have been exposed to influenza or had influenza, it can change into something that's less recognizable by your own immune system. And so those peaks will happen as the populations don't have the right reaction to the right way to recognize the flu viral proteins. And so about every 15 to 20 years, it's not unusual to see a wave that come through in terms of a higher peak. And sometimes we call them pandemics when it reaches across broad areas, multiple countries.
Anything to add to that, Dr. Thompson?
No, I agree. That's a very good description. It's when usually it's a new pathogen or a new variant of a pathogen that spreads widely across the world. Pandemic.
And I just read that it's only influenza A that we can get pandemics from. It's not influenza B. I just saw that in the CDC today. I thought that was interesting. I
Yeah.
hadn't known that. So, little tidbit for you.
Yeah, hopefully it stays that way.
Yeah, no kidding. I just jinxed us. Knock on wood. Dr. Rudd, you wanted to talk about public health. So, is the RSV vaccine recommended for those over the age of 60? And what are the side effects of the RSV vaccine?
Yes, they are now recommending it. We've been giving it to babies for a long time. We're now also recommending it to pregnant women so that they can help protect their babies. And we're just this year offering it to our seniors. So highly recommended vaccine to help reduce the chance of getting one more respiratory virus.
Okay.
We've seen more hospitalizations. We were just asking each other, I think it might be because we're testing more than we used to, but we are definitely seeing more in our seniors.
And how about side effects?
I have not seen a lot of side effects from that vaccine, so I don't know if others have, but it's relatively new, so we're just starting to use it in seniors. Again, we've been giving it to infants for a long time, and it's been well tolerated.
Okay, nothing else to add, friends?
And it also seems to last for a while. You know, we have to get a flu shot every year updated. The RSV vaccine, time will tell, but it seems to have a longer life, so you won't need it every year.
That'd be great, huh?
Yeah.
Yeah, exactly.
All right, Dr. Stover. Scott from Embarrass wants to know, what causes my nose to run more in the winter time? Is there anything I can take for it?
That's actually a good question, because the runny nose, sometimes we think of that as an illness, and sometimes you also have to think about it that it's your body's reaction to trying to keep itself moist. So the way the nose is built, and this is one of those fun facts I read a bunch of years ago. We put about a liter of fluid from our sinuses that are created to help moisturize and warm the air that we breathe in, catch all the stuff that we don't want to put in our lungs. But it's about a liter a day that is produced.
Wow.
Most of it goes down the back of your throat, and you never notice it, because it's flowing,
Nice
helping that
thought,
stuff
thank you.
flow. Yeah, but on cold days, there's changes in the kind of the moisture need in the nose. There's also changes over our lifetime, and so our noses get the little hairs that supposedly are helping us beat it backwards get changed a little bit. And I'm at that age, I'll admit it, that when there's even foods that will stimulate my nose to run a little bit. And I was dripping a little bit when I first came in, not because of an illness, but because my nose was responding to being out in the cold air and trying to help protect me from the extra dryness that's hard on tissue.
Oh, I'm glad I asked you that question. That's far more than I would have expected or answered.
The only other thing I would add to that is allergies are not uncommon in the winter too. We think of them in the spring and in the fall, but in the winter we turn on the airflow vents and we're putting dust in the air, and so it could be allergies as
And
well.
we close the windows and keep
Right.
keep things in the house. Yep.
Right.
All right, Dr. Rudd, I want to ask you this one again. Can you get emphysema from asbestosis exposure? And I guess let's just go back a step and talk with the audience about what emphysema is first.
Right. We use a lot of big words, and emphysema is really when the end of the airway, those little tiny air sacs kind of stop working, they fall apart, and we get bigger air sacs. And so there's not as much room for the air exchange with the blood. So we breathe in oxygen, and the oxygen gets circulated through our bloodstream at those little air sacs. As they break down and we get bigger areas and pockets, that exchange doesn't happen as well. And so Lots of things can cause emphysema, the most common being smoking. Other inhalations, whether you breathe fumes from paints or other things through your life can also lead to that. And there are a few other conditions that can cause emphysema, but it's kind of an end-stage disorder of the lungs. We see it most on x-ray. You can kind of see, instead of good air circulation, you can see that it's not moving as well.
Is it the same as COPD?
Well, COPD can lead to emphysema, but it's not the same.
Okay, thank you for that. All right, Dr. Thompson, Andrew asks, who should receive the pneumococcal vaccine? This is a good question. It's trickier than we think.
So, seniors should receive a pneumococcal vaccine. Kids should receive a pneumococcal vaccine. And other people who might have some underlying health conditions that affect their immune system, or if they have chronic heart or lung disease, some of those people should receive an extra pneumococcal vaccine. So there are a lot of people there, and it's a little bit complicated. So I would say talk to your doctor about which vaccine and if you meet criteria for some of them. But it's a really good vaccine in the sense that it protects against a lot of different strains of pneumonia, specifically pneumococcal pneumonia. But so there are a lot of different people, to answer the question, who would qualify.
I'm glad that you brought that up against the strains, because that's a question often we get around the vaccine for the flu, right?
Yeah.
Can you explain the flu vaccine and why there's some question around it?
So flu vaccine, unfortunately, we have to get one every year. We have to get an updated one because flu is always changing. Flu virus can live in people and in chickens and in pigs, and it likes to jump between species, and it's always mutating. So for that reason, we have to get an updated vaccine every year. And our flu vaccine typically covers 4 different strains each year. There's a lot of work that goes into predicting that, and which are the right ones to put in. And the track record is actually pretty good at matching those up. Occasionally it's not, and the vaccine isn't as effective.
It's not quite as effective as we want, but it doesn't do any harm.
No, there's no harm to the vaccine.
Okay, great, thanks. This is definitely for you, Dr. Stover. Ooh. Tom from Duluth wants to know, what might make it difficult to take a deep breath after a prolonged cold?
And that is a good question, because you get that extra time where you have that little cough, or you go and exercise, you want to go back into your running routine, and you end up coughing from it. And there's kind of the I always think of whatever infection gets you as sort of like an invading army, and then there's the body's response. And then there's the battle happens, and the immune system wins it off, and gets rid of the bacteria, the virus, whatever. But there's debris left over. And so some of the cells, some of the byproducts of that healing process have to also leave that area so that the lung can work effectively. Dr. Rudd was talking about how the alveoli work. They're very stretchable and very stretchy and flexible when they're in their best state, but in a state when they're recovering from a cold, they're still a little stiff, and so you had to cough that moisture out of there.
Anybody want to add to that? That was pretty, thank you. Are you
Very
a Boy Scout on your side routine?
I think the other thing to add is that shortness of breath and not being able to get a big breath can be infection. It can also be a symptom of other things. So if you're experiencing shortness of breath, or if you find that you're just not moving as much as you used to, you may be sort of compensating for not being able to get a good breath of air. So those are things to definitely take to your doctor to talk about.
Right, so that one time when you walk out in the cold and you get it is one thing, but if you continue to have those symptoms,
right,
whether in other conditions or if they just don't go away, right?
Mm-hmm. Right, and I think a lot of people don't understand that your breathing can be affected by your heart and your lungs. So it could be a problem in either system.
All right, you asked for the next question then.
Oh no.
Dr. Rudd, Joe in Duluth wants to know, what's the life expectancy for someone with mild emphysema and mild large airway thickening?
Yeah, it's a good question, and it's not something that I always say in medical school, they didn't give us the crystal ball to tell you that. Mm-hmm. And I think there are a lot of things you can do to extend your life, to make sure that you have the best quality of life. And so again, working with your doctor on what we call pulmonary rehab. We think about cardiac rehab after you have a heart attack, but there are things you can do to help your lungs to stay as healthy as possible, even if they have some damage early on. So early emphysema does not have to be a death sentence. It does not mean you're dying in the next 6 months by any stretch. So definitely encourage you to talk with your doctor about options that can help improve your quality of life and extend your life.
Anything to add?
Good.
All right, Dr. Thompson, this is a good question. Miranda in Marengo, and I might get that, I'm not from here, Wisconsin wants to know, are there side effects with statins such as increased risk of infection or leg muscle pain? How about the infection piece?
Yeah, statins definitely have side effects of muscle pain. Occasion, that's a well-known side effect. As far as a risk for infection, no. And in fact, sometimes when people have serious infections, statins have actually been shown to maybe help. So I would not have concern that a statin would increase a risk for infection.
Okay.
Agreed.
Okay, everybody agrees. All right, I'm going to ask you again. Can you get influenza twice in a season?
It is possible, and in part because there are multiple circulating strains of influenza. You could get influenza A in the fall and influenza B in the spring. So it's certainly possible.
Dr. Stover, why would a healthy, Teresa in Duluth wants to know, why would a healthy senior need to get vaccinations for influenza, pneumonia, et cetera?
It's one of those things that we all want to stay as healthy as possible, and each time that we do have something that makes our immune system have to work overtime to fix something, it's a drain and a strain on the system. And to be as active and engaged in all the things that keep us healthy, it helps to avoid those kind of infections. And as Dr. Rudd had talked about earlier, the flu can knock you down hard for the first week and often for a couple weeks after you're not back to your full level of activity that you'd want to be. And so to stay healthy is to avoid those times when you have to have those setbacks. And potentially sometimes with flu, more than just a mild setback.
And I'd say in general, our immune systems aren't as potent as we get older.
Mm-hmm.
And so what you might have tolerated well as a 40-something, you don't tolerate as well as you get older. So again, anything we can do to help ourselves stay as active as we can, I'd recommend it.
Right, it's our folks who are oftentimes our elderly folks who are more likely to be hospitalized for influenza and pneumonia.
Right,
whatnot.
or complications from them.
Right, right. All right, thank you for that. Dr. Thompson, can you explain linear atelectasis? You asked me not to ask the hard ones.
So that's a reading on an x-ray.
Okay.
So when we talk about lungs, we often will get an x-ray, and sometimes we can see what linear, meaning a line, we can see a line of thickening, and atelectasis means sort of collapse of lung tissue. So it's just a description of something we see on an x-ray.
And it can happen after pneumonia sometimes because the tissue doesn't have a chance. There's an injury, doesn't have a chance to re-expand. There's ways with pulmonary therapy and stuff where you can help improve that sometimes. Yeah.
This is a very serious one, Dr. Thompson. Is it dangerous to hold in a sneeze?
Oh, that is a great question.
Yeah.
In general, no. I don't think it's dangerous to hold in a sneeze. Unless you've recently had some sort of sinus surgery or some sort of ENT procedure, then I would talk to your surgeon.
Anything else to add? Because it's increasing your interthoracic pressure.
Mm-hmm. And the nasal pressure, yeah.
Mm-hmm. Yeah, good. All right. Dr. Stover mentioned the benefit of hair follicles in your nose. Is it bad to shave those hairs in your nose?
Well, I was thinking of the little cilia, which are tiny hairs that are kind of working there. But we do have hair for a reason in our nose. And it's amazing how, as we breathe in, if you ever look at a sunbeam sideways and you see how much stuff is in the air we breathe, that's part of what our nose and our sinuses do, is they're our muffler to kind of get rid of some of that stuff and keep our lungs clean. And so trimming the hair isn't going to change that function as much as other things we breathe in, as Dr. Rudd had said earlier, that can damage some of the tissue on the way down, toxins and things. So you can certainly trim nasal hair, but I wouldn't be aggressive in trying to get back in, and potentially again, your nose and throat people would frown on too much going up in the nose.
Dr. Thompson, how often can I get the pneumococcal vaccine? Can I get it annually?
It wouldn't be recommended annually. Actually, for most people, like seniors, you only need it once. There's a new updated pneumococcal vaccine and you only need it once. Some people might need it every 5 or 10 years, but it's not an annual shot.
And I'll clarify, so we had an older version, and so if you haven't had the new one, even though it's only been a year, we might recommend a new one now. So it is a little complicated.
Correct.
Right, that's why your doctors will know your schedule. Sometimes they have to look it up.
Exactly. Exactly.
What's the likelihood of COPD progressing to emphysema?
It can. It certainly can, and it depends on the severity, and it depends on if you continue to damage your lungs through whatever it was you were doing, like smoking. So I think we would be remiss to not talk about importance of quitting smoking and trying again to quit smoking, because it would affect all of the things we've talked about today. COPD, pneumonia, flu, all of those are worsened by things that you can do to insult your lungs further. So if you're a smoker and you are interested in quitting, I strongly encourage you to talk to your doctor. There are lots of things we can do to help you quit.
And people should remember it can take several attempts before you're successful at stopping smoking.
Right. One of the things with smoking that happens is those little hair cells she talked about that are deep down in the lungs get kind of paralyzed, so they don't keep moving all the stuff up and out of your lungs. And so people that smoke will tell you they often have a very productive cough every day. And that just is a great breeding ground for all of these bugs that we come in contact with. So smokers are at higher risk for infection.
All right, we have a few minutes left. What else do we want to share with our audience about public health?
You know, I think we talk a lot about it right now too, masking and things like that that we can use when we have had an illness ourselves, but we want to go out in public and do something. It's not a bad idea to have that opportunity to protect the people we're going to be nearby for a while. We luckily don't have to mask continuously, but when you're ill, that can be a helpful thing.
Yeah.
Or when you're in crowded places, especially
Airplanes.
crowded places like in schools. And,
Right. I think all the general precautions, hand washing, wearing a mask if you're going to be in a crowded place or if you're not feeling well yourself are good. And then getting your vaccinations for sure.
I think hand washing is one of those things that is underrated, and we should be doing more of it, just regularly. Yeah.
For sure.
Dr. Thompson, Sarah wants to know, is there a difference in how adults and children are vaccinated for influenza?
There's not much of a difference, no. It's the same shot, the same components are in the shot. Really young kids get a different dose, and their first time they would actually get 2 shots in that first year. But it's the same vaccine. Okay. Older folks will actually get a higher dose vaccine, and that works better because their immune system needs that stimulation to form a good response.
We talked before the show how one of the things that we're seeing as physicians that's a little bit hard is that we know that our patients don't always trust the COVID vaccine, and we're trying to talk with them about that, but now we're also seeing a mistrust of the flu vaccine, so a little carryover. Are there ways that we should counter that, or we can think about that? And
Well, I think even more importantly, we saw a real fall behind on immunizations during COVID because parents couldn't bring their kids out, and so we have a lot of catching up to do. So a lot of our kids are behind on vaccines and really need support to get those caught up. And then, we still have a little bit of hesitancy around all vaccines. I think that the COVID vaccine just got parents really questioning things. So strongly encourage you to talk to your doctor. I think all of these vaccines are very safe and proven and can help prevent some serious complications and hospitalizations.
It's interesting with the COVID vaccine because there were such large numbers during the epidemic. It's the best studied vaccine in the shortest amount of time that we've ever had. And so it's pretty well understood.
Intense amount of science behind that one.
And it saved many lives. It saved millions of lives across the globe. It's hard when something works, when something's successful, sometimes to see how well it works. For instance, measles. There's a measles outbreak in the country right now because people have been reluctant to get vaccinated. So when something works well, like a public health intervention, we really have to work hard to convince people that everyone should do it.
And that we don't get any extra money for all those vaccines. We're
No.
really concerned about our patients.
Right.
Yeah.
Try to promote that.
Correct.
Okay, last words of wisdom, anyone?
Wash your hands, take good care of your, foundationally take care of your health, and talk to your doctor about the right vaccinations for you.
It's not too late to get your flu shot or a COVID vaccine. We are seeing a lot of activity now. That means there's still weeks more of that.
COVID too. Lots more.
COVID and
Okay.
flu
Okay,
and RSV.
okay, good. Anything else,
Sure.
Dr. Red?
Oh, I was just going to say, and if you're a smoker, reach out. We'd like to help quit. So
They're all going to be calling your clinic.
there we go.
All
Good.
right. I want to thank our panelists, Dr. Jane Rudd, Dr. Sandy Stover, and Dr. Andrew Thompson, and our medical student volunteers, Kayla Egens, Mary Jane Evans, and Logan Hooker. Please join me again next week for a program on upper extremity shoulder, neck, and back problems. My panelists will be Dr. Matthew Davies, Dr. Billy Hogue, and Dr. Dino Terzig. Thank you for watching, and good night.